Good day, everyone. I am John, your moderator for this webinar. I welcome everyone for today's webinar, which is called Deconstructing the Medicare Revalidation Process. So now I would like to introduce our presenter for today, Tony L. Holmes. Well, she is my favorite speaker in hospital. I have never seen the webinar that she does all time, and her smile is awesome. So let's come with the bio. Tony L. Holmes, CCS, CPC, CPMA, CRC, AHIMA approved, ICD 10CM, and PCS trainer in internationally known speaker and recognized subject matter expert on medical coding, reimbursement, and revenue cycle management. She is the founder and CEO of Alpha Coding Expert LLC. So now I would like to hand over the floor back to our speaker. Over to you, Tony.
Thank you so much for that great introduction, and thank you to all of our attendees today. And today we're going to be talking about the process, the type of revalidation, the forms that you're going to need to have access to. I just want to remind everybody the revalidation process is an important process to check in, but you're required to update this information regularly every 30 days. So your Medicare administrative contractor, depending on where you're at in the country, is very important for you to know. This is the entity or the contractor that's facilitating claims. You're not sending it to CMS, you're sending it to the Medicare administrative contractor. So there's two ways to revalidate. There's the paper way, which is the CMS 855 forms. You can use those. Nothing wrong with using the paper forms, but there are some nuances that you want to be aware of. So the NPPES has a public registry. So if you don't have your provider's NPI numbers, if you're somebody, let's say you just got into an organization and you're kind of trying to figure it all out, you don't have a roadmap or access to all of the provider's information, you can go into this website and you can look at any group NPIs, provider NPIs, and you can also see the taxonomy codes attached to your providers. So this is very important. So then you'll have your PECOS access. So either your provider is going to have access to PECOS, or if you've been set up as a surrogate, you will have access through the Surrogate Program. So revalidation is required if you're going to participate in the Medicare program. It's required under the Affordable Care Act. So there is a really nice tool online that you can go to, and you can check for your revalidation. You can check your organization's revalidation date. You can check your provider's revalidation dates. So basically you'll go to this website. All of this will be shared with you, data.cms.gov, and they have a data file as well as just this kind of interactive tool that you can go through and search your providers. So the tool will tell you when your provider has a revalidation due date, if that's been disclosed. If it's not, then it'll just say TBD, which means you're not up for revalidation yet. And then when you actually search it, you'll see these dates. So like these are organizational NPIs that are checked. So this organization does not have a revalidation due date. You can see where it says TBD, so you're good to go. And you can also see the enrollment type. So then we get into the actual revalidation. So just verify that your entity type is correct when you're revalidating, and if it's not, then you obviously want to get that updated. So I talked about surrogacy. So the surrogate program is very important. If you do not have surrogate access, you need to get it. So surrogate, if you're an authorized surrogate, then you can add, modify, or terminate providers from the group. So if you've got a group practice, this is really important because you got to keep those things updated regularly. As far as officials, again, you'll kind of want to know these things as we're looking at the applications. So an authorized official is someone that can work in PECOS for or on behalf of the provider or the organization. So now we're going to segue into the actual applications. We'll be focusing on the 855B and the 855I applications. You have 30 days to respond, and if you don't respond, they'll likely deactivate your Medicare and your privileges to bill Medicare. Those are the main sections of the forms that you'll want to be aware of. Lots of nuances depending on the type of provider you are. And so you'll want to go through these different scenarios to make sure that you're filling out the appropriate applications. So one of the required supporting documents is the Form 460. So it looks like this, the Medicare Participating Physician or Supplier Agreement. Very important. Patients have a lot of questions as to how that all works, so it can be kind of a nightmare. So Form 460 you'll want to be aware of. The next form is the EFT Form 588. So this has to be included with your revalidation. Some other helpful information that you want to include: current licenses for practice locations, the tax documents, IRS documents, due diligence checks. So please make sure that you're doing due diligence checks on when you're revalidating providers, when you're hiring new providers. This is super, super important. Revalidation fees. So there are fees associated with revalidation, but they don't apply to everybody. So if you're a physician or a non-physician practitioner or a group physician practice or anything like that, you don't have to pay any type of revalidation fees. These are assessed to institutional providers and suppliers. So if you don't revalidate, you can be deactivated, which means you won't be able to bill Medicare. So some common errors: the people that are authorized as a delegated official or authorized official, they also have to sign off on these the revalidation applications. So go into that revalidation portal and get everybody checked. And if you see TBD, then set a tickler in your system so that you know, okay, in a few months I need to check again, just so that you are cross-checking and not missing anything. Make sure that everything's accurate and consistent. So very, very important. So I've included some resources. This has been such a pleasure. I've really enjoyed this session. I hope it's been helpful to everyone. Thank you so much.
Thank you, Tony. Hey, thank you, Holly. And thank you, participants. Have a great day.